Colorectal cancer refers to the cancer of the colon or the rectum. It is the third most common cancer in the world, and screening can prevent colorectal cancer. Find it early when cure is most likely. The colorectal wall is actually made of layers of tissue, and the innermost layer, which is in contact with the stool, is actually called as the mucosa. Areas of abnormal cell growth are called as polyps, and these polyps are usually found in the mucosa. While most polyps do not become cancer, almost all colorectal cancers start as polyps. They can be in many shapes. Raised polyps, they look like mushrooms, which are called as pedunculated polyps. Sessile polyps have raised tops and wide base. Usually, a polyp takes many years to transform into a cancer. So how does screening help? Screening saves lives. Screening prevents colorectal cancer when polyps are removed before they even transform to a cancer. Screening finds cancer early before these symptoms actually start, and it is easier to treat or cure. Now, some of the screening tests that are available are endoscopy. Endoscopy means it involves a handheld device that looks inside the colon or rectum to look for any abnormal growths. Now, imaging is another form of modality which you can use, and that takes pictures from inside the colon or rectum. And there are certain lab tests that look into finding blood in the stools or blood cancer markers, which is, for example, a CEA marker. But some of the symptoms that you need to look out, for which you need to go to your doctor immediately, are change in bowel habits, like you could have an alternating diarrhea or constipation or a recent change in your bowel. Anytime there is an iron deficiency anemia detected, especially in the elderly population, and at any point of time if you have blood in stools, definitely you must seek medical attention. A very important question is, at what age should you begin screening? Now, screening essentially depends on what is your risk status. Now, how do you determine if you are at an average risk or are you at a high risk of developing colorectal cancer? Well, there are certain features that make you have an average risk, and there are certain features that put you in the high risk category. Now, you are an average risk patient to develop colorectal cancer if you are at least 45 years of age and have no other major risk factors. What are these risk factors that actually make you at increased risk for colorectal cancer? You are at increased risk if you have a family history or a personal history of colorectal cancer or advanced precancerous polyps. If you have either a history of an inflammatory bowel disease, either in the form of Crohn's disease or ulcerative colitis, and you've had this for many years, you are at increased risk of developing colorectal cancer. So what are the screening tests available if you are at average risk of colorectal cancer? You could go for a colonoscopy. A colonoscopy is the examination of the colon and the rectum, where a thin device is inserted gently through the anus, which is the opening where you pass your stools. Also, you have a flexible sigmoidoscopy, which is again quite similar to the colonoscopy, but instead of looking at the whole colon, it will look only at the last part of the colon. You also have something called as a CT colonography, where you take X-rays of the colon. Now, the advantages of these tests, the colonoscopy, the flexible sigmoidoscopy, and the X-ray, the CT colonography, is that once you have a clear test, the next test you do it after many years. It's a very long interval between the two tests. So if you have a good and a clean test, you know that the next test only comes after many years. The issues, I would say, with these tests is that you would require your bowel to be prepared, you need a bit of sedation, and there is a very small risk of bleeding, infection, or injury. So once you've done your screening test, how often would you rescreen yourself? Now, if you've opted for a colonoscopy, the next time you rescreen is only after 10 years. If you've opted for a sigmoidoscopy, you will have to rescreen every 5 to 10 years. Now, if you do a sigmoidoscopy and then you choose to do a FIT test, which I just mentioned before, if you do a FIT test every year and then you've done a sigmoidoscopy in the past, then you could repeat your sigmoidoscopy after 10 years. Otherwise, it is every 5 years. Now, if you choose to do the stool-based test, that is the multi-targeted stool DNA-based test that I mentioned, the next time you repeat it is after 3 years. However, if you end up doing either the high-sensitivity GWAT-based test or the fecal immunochemical test, that is the FIT test, then you have to repeat this test every year. Now, what happens in cases where you don't have adequate bowel preparation or the doctor could not actually see your colon properly because of fecal matter in your colon or rectum? Then you would have to repeat your test at a 1-year interval with a proper bowel preparation before you go on to these guidelines that I have just mentioned. Now, another very important question asked is always, what is the best screening test that I should do? Now, I would like to say that any screening test is good, and my message would be, please go ahead and do any screening test because a screening test is must. What would you do if you had high risk features or you are at high risk of developing colorectal cancer? Now, the guidelines for investigation and screening are slightly different, and I'm going to address this in my next video.